Oh, baloney. The whole thing always gets back to drugs.
Hello, my name is Sandro Graca and I'm a licensed acupuncturist. Welcome to a special edition of the video blog posts where today we are going to have a guest online to answer a few questions. And following on from the last few video blog posts, we are going to continue with the PCOS series. So we are going to go now to split screen and I will get you to meet our first guest. So here we are in split screen now, and I would like to introduce you. A colleague of mine is doing the master's degree with me since last year. We've done a bit of work together for some of the assignments, and her name is Maya Harish. She is in Israel, and she's a naturopath. So will I just get you to introduce yourself to everyone, please?
Hi, everyone. Like Sandro said, I'm a naturopath. I live in Israel, and I'm taking the same master's course that Sandro is doing, except focusing more on naturopathy than on Chinese medicine.
So just because around this side of the world, and I know definitely for Ireland, people wouldn't be that familiar with what does a naturopath do. So if someone walks into your clinic and sits down in front of you, what is it that you do? What is your approach to treating that person?
Okay, so unlike Chinese medicine that has a whole different set of rules and is based on something completely different, naturopathy is more based on Western medicine, but with a holistic approach. So I would look at the same diagnosis and I would look at the same lab tests that your GP would, but my approach is to see more of the whole person, not just what the symptoms are, but why is the problem what it is, what causes it, what's the root cause of it, and I would find out alongside the patient and how we can fix it together in a more natural way.
Yeah, because with Chinese medicine and with acupuncture, you would have kind of almost like that split where you would have like the pretty much straightforward traditional acupuncturist where they would be looking at the pulse and the tongue and asking questions to the person in front of you. But you would also, within some of the acupuncturists, you would have the ones that would be working in a little bit more integrative way where they would have, yes, they would still know how to use the pulse and the tongue, but they would also be able to look at the labs and kind of working in conjunction with, say, GPs, dietitians. And so then tell me, like, from a naturopath's point of view, like, is there, person comes in, is there what is your treatment then? What do you then do with the patient?
So the first thing is I would talk to them and find out what it is that is bothering them, why they've come in. They might come in with a label, like we were talking about PCOS. So you might have this label of PCOS, but what are you actually feeling? Because the PCOS can have a variety of symptoms, which you can have some and not all. It's kind of a mix and match. So I would see what is actually bothering the person and try to figure out what the cause of it is. And then try to treat the cause, the root cause of the problem, as opposed to superficial symptoms, which would also get fixed, but which also prevent any worsening of the situation.
Yeah, so for the reason why I wanted you to be here and have a presence for this vlog is because over the last few weeks I've been focusing more on PCOS and just trying to look at different approaches, because I started with just explaining a little bit about what are the symptoms that you'd probably be expecting to see a patient with, and that doesn't have to necessarily even be the acupuncture clinic or even your clinic, could be anywhere. And then I kind of moved on to what would be the treatment approach from our point of view in terms of Chinese medicine and acupuncture. And one of the things that came up with that was there was a lot of exercise, and one of the studies that I mentioned on the latest video actually compared one of the groups was getting exercise and the other group was actually getting acupuncture, and see what was the difference between the two. So the ones getting exercise and acupuncture, the ones getting just exercise or just acupuncture. And one of the things that does come up a lot is dietary advice, and that's independent on being on any supplements or any medication or even Chinese herbs. Diet advice comes up a lot. So again, can we just, I can totally understand, and I hope that people understand as well, that if someone comes into the clinic, you're not going to be looking at, oh, you have PCOS, so here's X prescription or X treatment for you. What would you be? So do you want to go through like what's the most common thing that you would see? I don't know if there's, like, for example, here for Ireland, because of the cold and damp, we would see kind of a typical PCOS type woman, and we would kind of, again, the same thing, try to address those little, try to go bit by bit at the label rather than just addressing the whole. So what would you do first? Like what is your approach to treatment?
Well, so first of all, we'd find out what is actually bothering you specifically at this moment. So you could have PCOS and you might have fertility problems, but that's not why you're coming to see me right now. Right now, you're coming to see me because you're gaining weight and you can't lose it, or you'd be coming in to see me because you've got mood swings, you're suffering from depression. So it can be all sorts of different problems, and it could even be that you're coming to see me because you've heard that PCOS can increase risk of things like hypertension and sorry, can't say that, hypercholesterolemia, or type 2 diabetes, or because you're worried that you've heard you'd have increased risk for heart disease. So you could be coming in to see me for those things, in which case that would be the first thing we treat.
Yeah.
And then we'd look at why you're suffering from whatever symptoms you're suffering from. So with PCOS, it's a little bit more difficult because there's no clear etiology for what causes PCOS. But what we do know is that there's a connection to weight, and there's a connection to having an imbalanced diet, which is most often it would be high in fats and sugars. And we know that high levels of insulin damage the female hormones, and they also cause an excess production of male hormones. So we would look at which of these actually is appropriate for you, because you might be a very skinny girl with PCOS, in which case weight gain is probably not the problem with you.
Yeah.
But being skinny doesn't necessarily mean that your blood sugar levels are balanced. So we'd have to have a look at that and have to see how your stress levels are and what could possibly be the other causes of the symptoms you're suffering from.
So basically, you're just saying that there's no magic cure, there's no silver bullet, there's no magic wand. You just, I know, I can just imagine people hearing this and going, oh, but I wanted to know, what is it that I can do? And it's a very good point. I know I've only touched briefly on one of the previous videos, but and I'm glad that you brought it up as well, because it's the risk of, even if the condition is just there on the background, and the woman is trying to get pregnant, a lot of those symptoms can then be just exacerbated during pregnancy and can bring about a few complications. And that's something that we see so many times in the clinics. And I say this to patients all the time, that positive pregnancy test is a big step, but it's only the beginning, and we need to be careful and just continue looking at that pregnancy to
It's absolutely true, especially because women with PCOS have a higher risk of miscarriages and all sorts of problems throughout pregnancy, including gestational diabetes.
Yeah, that's a good point, because normally you just really get I see this in the clinics all the time, the focus is on, oh, I might get gestational diabetes, but that's manageable enough. And you go, well, yeah, that's correct, but there are other things. And sometimes you don't really want to be mentioning those in the clinic, but that is absolutely true. You need to consider those. So symptoms that might be there on the background. And as you said, it might be just someone coming in saying that, I've got bad period pain, or my cycles are very irregular, and it's just uncomfortable, and they might not be thinking about the trying to conceive and staying pregnant at that stage, but it is important for them to know, and sometimes to talk about, those scary words like you said about, heart disease and problems in later life if just left untreated. Yeah.
I think also it should be mentioned that I've said some scary things, but it's not about having to worry about it. It's about taking the appropriate steps to prevent these problems from ever manifesting.
Mm-hmm.
And then it doesn't have to become a big, scary issue. It can be managed in a preventative way, which is what we do.
Absolutely. And you see that everyone, even from a gynecology point of view, you will hear, and endocrinologists as well, would say to the woman, look, dieting would be good. It's a diet that will be appropriate to you, not just a general diet, and exercise. So it's a condition that the treatment itself, the person has quite a lot of power in terms of what they can and what they should do to help themselves.
Absolutely. And then it would be focused more on how you can balance your hormones, how you can reduce your symptoms, how you can prevent fertility problems, and how you can reduce the risk factors for all the other issues.
Mm-hmm. Yeah.
And it's absolutely doable, and it's not necessarily the end of the world. It doesn't have to be such a dramatic change. You can take quite simple steps that can dramatically improve your situation.
Yeah. So I know you have your own, and I'll do the plug now here for you. I know you have your own YouTube channel, and there's plenty of information there. I've actually mentioned that on, I can't even remember, was the first or the second video or something, and really liked it because it's simple things that people, it's almost like everyone knows, but what they know, it's actually from just checking online. And sometimes Dr. Google is not the best of, and you can read one website and says one thing and the other one says something completely different.
I think the thing about Dr. Google is he's really scary.
or oversimplistic as well. You know, it's either going to be bad or it's okay, you can keep on doing what you're doing. And again, taking in, and I know I'm going to put you on the spot here a little bit, but taking that consideration that everyone's going to be different. But again, just imagining people listening to this and wanting to know a little bit more, can we just go on, I'll ask you to just free space to talk about fats and sugars. What are the major do's and don'ts, in your opinion, from your own clinical experience? Just, if you don't want to, you don't need to go into big detail, but I know that everyone always wants to know, are they good, are they bad? I think I know what the answer is going to be, but I'll let you.
Well, I try my best not to go into extremes of good and bad, but to stay in terms of what is manageable for you. So the first thing is, if you reduce processed food intake, you're reducing your levels of sugars and fat 100% of the times. So that is the easiest thing you can do. Just cook at home, because I highly doubt you'll use the quantities of sugars and fats that you will find when you buy food outside. So anything processed, if you can eliminate that, that's already taking a huge step towards health in any situation, by the way, not just PCOS. So then I would say about sugar, because we know that there's a serious connection between insulin resistance, sugar intakes, and PCOS, I would say that you can probably Google and find out more about glycemic index. There are quite substantial lists online that tell you what the glycemic index of any food is. So what you're trying to do is have foods that have reduced glycemic index and not foods that are higher. So that helps your body process the sugars in a slower way, which is basically what you're looking for. We're trying to avoid the sugar highs and the sugar lows. So if you're keeping your sugars balanced, that's the easiest way to do that. So avoid things that are highly processed and try to have low glycemic index foods, which is fruit and vegetables and whole grains and legumes, so beans and lentils and things like that. And in terms of fats, what we're trying to reduce is I don't really like saying reduce fats, because I think people find that stuff really confusing, because then it's olive oil okay, is avocado okay, should I not be having any of that? So what I always try to say is try to increase the intake of the good fats, and that is, like I said, olive oil, and it's avocado, and it's nuts, and it's seeds, things that are naturally available. If you can't see where it's come from, if you don't know where it comes from, try to avoid that.
What's the if you look at the label and if you can't pronounce it, then don't eat it? Isn't there's something like that as well, isn't there? Yeah.
Yeah, my rule is simpler than that, because I don't try to get people to read things with 13 letters at the supermarket. If it's got more than 5, 6 ingredients, it's probably not that good for you.
Mm.
It's just very, very basic. You want to know what all the ingredients are. You want to know where they came from, and you don't want to have more than 5 or 6 ingredients.
Yeah.
That's it.
I know people in the clinics will always say that, oh, but it's convenient and I can get it in the supermarket and whatever. But we go back to that same old story, isn't it? Health is pretty much in your hands. It's what you do on your day-to-day life. And yes, some days it might be really, really difficult and almost impossible for you to have what you should be eating. But still, there's always going to be a little something that you can do that will actually help.
So there's research that's actually I found absolutely fantastic. And what it was saying was that people who eat in 5 meals, 5 of their main meals a week at home, are likely to live up to 10 years longer than people who eat out the majority of their meals.
Yeah.
And 10 years is a long time.
Yeah.
I mean, that's a dramatic difference. And that still enables you to have 2 nights out. I mean, it's not saying stay at home, live like a hermit, don't do anything that's ever bad for you. No, that's fine. Be a person, enjoy life.
Yeah.
Just try to think ahead.
It's all about the choices. Yeah. And that's what I was saying before, that luckily enough for the people that have been diagnosed, or even if they suspect, or if there's some of the symptoms there, I remember from one of the videos saying that PCOS is actually highly treatable. Even if it includes medication, that's fine. You can still be doing loads of things alongside it that will help. And that means less medication, and ideally can even bring you to no medication at all, which would be even better. So it is all about choices. I know I can hear people, saying that it's too difficult, and I can just say that those 5 meals a week at home, I'm pretty sure that's not microwave, though, is it? That's
no,
not,
they mean home cooked.
Yeah. And it's so simple, like something something that we actually do here at home is wintertime soups. Like, it's just so easy, and you can have it for a few days ahead, and you're actually getting all the goodness from everything because you're using the fluid that you're cooking everything in. So you're not really wasting anything. So that's just such a great idea.
I'm a huge fan of freezing. Just prepare. If I prepare a meal, and then I have however many portions, but usually there's at least half of what I made that's left over. It goes in the freezer, and then when I don't have time and I don't feel like it, I just pull it out. And also, when you said about soups, so what I do is I get an organic vegetable box delivered weekly, and then all the bits and pieces that I don't really like, enjoy, or know what to do with go in to make a stock. And then I just have this stock that's sitting, waiting for whatever I feel like, and it's always available, and it makes things so much easier.
Yeah. It's funny you say that, because I hope that there's loads of patients from my own clinic listening and watching this now, and they will go, oh, he tells me that all the time, even if you don't like it, just mush it into soup, and you don't have to even know and taste that it's there. So
it works.
Yeah. So just one more thing very quickly, because I want to just kind of trying to link that food intake. And I know you mentioned the 5 times a day. Again, something that I talk to people in the clinics a lot. Same thing with fluid and food intake, little and often. In your opinion, and again, we can go health-wise, or we can just go a little bit more PCOS if you think that it's appropriate. But in terms of those meals compared to eating early in the morning a little bit more, or later in the evening, how would you spread that, and where would you put exercise? Would you put it first thing in the morning, go for a walk, try to do it at lunch break if you're in your office situation, or would you do it in the evening and do loads, but then you kind of have to eat after that? Where would you stand on that?
Okay, so there are 2 different things here. First is, when should you eat, and the second is, when should you exercise?
Yeah.
Now, when should you exercise? I can tell you that it's possible that there are ideal hours, but that doesn't matter. Exercise when you can. If you're the type of person who gets up bright and early and is happy to go for a walk, then that's fantastic. Do it then. But if I say to you, you have to get up at 5 o'clock in the morning and go for an hour's long walk, and that'll never happen for you, then that's kind of useless advice. I'd rather you go for a walk in the evening if that's more suitable for your lifestyle, or during your lunch break. Whatever actually works for you is what works, because the only thing that really matters when it comes to exercise is that you do it. So that's the first thing. And the second thing is, when should you eat? And this is actually an interesting question, because I can answer it in a few different ways. So some people would say it's best to have your meals at regular hours, and to try to keep it so that there's not more than 3 to 4 hours during the day in which you don't eat. So it doesn't have to be a big meal, but you can snack throughout the day, more of a grazing style, which is appropriate for some people, not for all. The advantage of it is that it does prevent sugar highs and sugar lows, because you're keeping relatively moderate quantities of sugar in during the day. Having said that, there's also research that says for women with PCOS, one of the things that has helped reduce symptoms is having the majority of calories in the morning. And there's an old saying, something about eat like a king in the morning, queen in the...
And the pauper in the evening, something like that. I remember.
Something like that.
Yeah.
So some women do experience symptom relief when they do that. But again, it really depends on your lifestyle, because if you go to the gym at 10 o'clock at night, then eating like a pigeon or a hermit or whatever it's supposed to be in the evening isn't going to cut it.
So
you need to just be aware of how you can adjust the recommendations into your life, and that requires a lot of flexibility, and it often helps if you can have someone you can ask, and then you get a proper answer that isn't just generic advice.
Yeah, absolutely. No, I know it was a trick question, because I remember we talked about this before a few days ago when we were talking about doing the video, and I thought that was really interesting. But because a lot of the times, if you're talking specifically, if you're talking about that business type woman, exercise is probably going to be in the evening time.
Mm-hmm.
I've been there, done that myself. I know that after that, I'm probably going to be eating more. And I can just see, like, one of the common things that happens so many times in the clinic, what did you eat after? Well, yeah, I left the gym and I had a banana, and then I went home and I ate, I can just see things that, yeah, they are healthy, but are they that healthy with that amount of, and I know they're good sugars, but will they be that healthy if it's after exercise in the evening time?
Well, a banana is, I would say, it's good food. It's always going to be good food. The question is it enough after exercise? And that's really personal, because it depends on what kind of exercise you've done. Exactly. And how intense was it. And some people, I meet a lot of people who say they go to the gym, and then you ask them if they sweat at the gym, and the answer is, I haven't actually changed my routine in 2-3 years. So no, I'm sort of used to it by now. So it sort of depends on the type of person you are. But also, I would say that one of the most important things about PCOS is stress reduction. Yeah. And stressing over what you're going to eat and Absolutely. What time you should eat it, not helpful. Yeah. It's not helpful.
And that's a very good point on hearing, sometimes getting women coming into the clinic and say, well, what my GP told me that I need to lose weight, but then my gynecologist said that I need to exercise more, and now you're telling me when I should. And they go, actually, you know what, let's just step back from that a little bit more, because yes, you can easily have one person saying about food, the other one saying about exercise, the other one saying about stress. And yeah, as you're saying, that's just going to end up just putting them under more pressure. So simple advice would be much, much better. And I think just to end on a very good point, as you were saying, ask for advice, and that's very, very good. And I do that all the time, and then people that have been watching the vlog now know, and that's the reason why, you know, you're here as well, is that yes, I do know a little bit about dietary advice, but you know what, if I'm not sure, I'll go and ask someone else, and I'll even go and, you know, do more training, do more learning, do CPD courses, whatever it is, just to get a little bit more. And that's great, because then I can network and I can meet people like yourself, and then just say, you know what, instead of me saying it, let's have someone else that will have a little bit more authority on that. So on that note, if anyone wants to know more about you and where you practice and what you do, website, where you are, and don't ask me to speak in Hebrew, because we've been through this before and it's just not
Well, you can find me on Facebook. You can find me on my website, which is mayanaturopathy.com. And the next project, hopefully to start soon, will be actionforwellness.com. So you can look out for that. Hopefully in next month should start running. So that should be exciting and provide more assistance for people around the UK.
And you can check her out. I'll leave the links for that in the description area. And you can also check out the Maya's YouTube channel, which I don't know the link for sure, but I'll leave it down here so you can click. And yeah, I suppose people will be able to leave you questions there if they want to, or even
and you can comment on this video. I'm happy to, if you see any, I'm happy to reply to that. That's no problem.
Okay, so there you go. Listen, Maya, thank you so much for being here with us today. And I can just see that this might happen again if people start asking too many questions. But if it ends up being tons of work for you, you're welcome.
Thank you. It's been a pleasure to be visiting your blog.
No, thanks so much for being online. And as I always say, remember, you know, until next time, be kind and be healthy.
Oh, baloney. The whole thing always gets back to drugs.